Hi, I'm Jordan Jennings, and I'm a physical therapist assistant, and I work here at Clarinda Regional Health Center. So I'm a native from Stanton, Iowa. That's where I graduated high school. I then went to Southwestern Community College, played a couple years of sports, basketball and softball, and then I ended up going to UNO, which is the University of Nebraska at Omaha, where I got my degree in exercise science and a minor in psychology. After that, I went to Clarkson College and got my degree in physical therapist assistant. Specialties, I recently got certified in women's pelvic floor therapy, level 1 through Herman and Wallace, also with antepartum and postpartum, which is dealing with pregnancy and then postpartum. I'm very excited to offer pelvic floor therapy here, especially since it is not really readily available in the rural area. I work alongside Kenda and Haley, who are physical therapists, and I feel like we make a very good team while we're bringing the service to the area, making everyone feel comfortable. I also really enjoy pediatrics, orthopedics, which is a lot what we see here. Orthopedics is definitely the number one thing we see, but being in a rural area, we have to make sure we're up to date with almost every diagnosis that's out there. I also just recently got certified through the PTA, which is our credentialing unit through the physical therapy, and I am level 1 certified to be a clinical instructor. Throughout the last few years, I've taken several students, and I really enjoy getting to be in their process. So I've known I wanted to go into physical therapy since I was in 7th grade. In 7th grade, that's when we had a career fair. So I had a teacher bring in different career paths, and when the physical therapist was talking to our class, I immediately knew that's what I wanted to do. I thought it was all sports related, and that's kind of the direction I went. But the more I learned and job shadowed and got to know people within this career, I fell in love with the whole thing. I love treating people as a whole. So I want to know everything that's going on with you, whether it's physical, mental, emotional. We really get to know one another as I get to work with you several times a week. So we kind of build a bond where we're working together, not just me working with you or you working with me. We really get along and develop a plan to get you where you'd like to be. I actually started my journey here as a student. I was doing my last clinical rotation, and Mike Hartman was my clinical instructor. About 3 months later, so after I graduated, I got a phone call from him, and he said, "Hey Jordan, do you want a job?" I was like, yeah. I loved it here when I was a student, so I knew it was gonna be a perfect fit. I started out part-time for about 2 years, and then I was offered a full-time position, and from there I just knew this is where I wanted to stay. I just love getting to know the people here in the community and seeing all the connections. So what keeps me here is definitely my coworkers. I have built a strong bond with them, and it's such a rare group. We all get along very well, and we all kind of promote each other to be the best we can. We're all around the same age, and so we mesh inside of work and outside of work. But other than that, we all care for our patients. We want the best for them. We're always looking for the newest research topics and what we can bring to this rural area. So it's very encouraging for myself and for everyone in the community that we have that here in Clarinda. It's also very helpful that the hospital has tremendously helped us achieve these goals by supporting all the classes we want to take, helping us with this beautiful new building that we're in. It's really helping bring more to the Clarinda area, and not just Clarinda as a town, but other surrounding towns. So outside of work, I enjoy golfing, I enjoy reading. I'm also a mom, so I have 2 daughters, and we love to be busy, whether that's within the community with activities or school activities.